Okay, this is all our equipment. So we just try to use whatever we have and available, and some of it's just gonna be a pretend one. We have a blood pressure, we have stethoscope, we have all the equipment that we might need. Good morning, I am Riza, your nurse today.
Hello.
I am here to do a head-to-toe assessment. How are you doing today?
I'm good, thank you.
Why you are here today?
I'm just here for a checkup.
Okay. You're supposed to do eye-to-eye contact with a patient, but I'm trying to explain her not to block the visual, the camera. Okay, I'm doing a demonstration. Can you state me your name and date of birth?
Jessica Lake, 32077.
Good. Where you are today? Where are you today? I mean.
I am in the clinic.
Okay. A patient is oriented. I seen him coming to the clinic and she is not shuffling, no shuffling gait, and she is not having hard time walking. She can articulate well and do a conversation without trouble. And then expression and affect is good. Seems like the patient is calm and appropriate and dress up appropriate according to the weather. So I want you to do, we're just going to pretend that we have a sniffing chart here. Can you read the tiniest word that you can read for me?
A, D, C, P, F, R, Z, T, L.
Good. The patient had 20/20 vision. So I'm going to inspect the head. The head is symmetrical. Do you have any pain today from 0 to 10? 0 is the none, 10 is the worst.
0.
0, that's good. So patient had no pain. The head is symmetrical. The hair is clean and intact. No pain, no lump noted. Can you open your mouth for me? Smile. Wrinkle your forehead. Puff your cheek. Okay. Can you open your mouth and clench for me? Okay. I'm checking right now the nerves and cranial nerves of the patient. So I'm gonna check the cranial nerve 5 and 7. Can you close your eyes and can you tell me if you feel this one?
Yes. Yes.
Okay. Can you close your eyes and can you tell me if you feel any sensation?
Yes.
Okay.
Yes.
And then I'm gonna feel the temporal pulse of the patient. It was there. Okay, I'm gonna check all the periorbital sinuses. No pain.
No?
And I'm gonna feel all the lymph nodes of the patient. I did not feel any lump or any tenderness. Can you push against my hand? Can you push against my hand? Can you move your head up and down? Patient was able to move without trouble. And then I'm gonna check the gag reflex and the mouth of the patient. Can you open your mouth for me? Can you see? Okay. Gag reflex was intact and there. I see the uvula not swelling and the tonsil is not swelling. The mucosa was moist and pink. I'm gonna let you close your. Can you tell me what you smell?
Orange.
Orange. Good. Can you do this? Yes. So the nostril of the patient is intact, and as what she said, that she could smell the orange, the smell her cranial nerve number 1 is intact. I'm gonna check your nose turbinate, if it's there. Turbinate was there, intact, moist, no obstruction, as well the patient can smell and deny the pain. And then I'm gonna check your light corneal reflex, okay?
Okay.
Patient's eyes is, pupil is round, reactive to light and accommodation. I'm gonna check the visual field, okay? Can you tell me when you see it?
Yep. Yep.
Then I'm gonna do the cardinal gaze. Can you follow this one? And that one is the extraocular muscle function. Then visual field confrontation was checked and intact. Patient was able to follow the command. Then the conjunctiva is clear, conjunctiva is pink and the sclera is clear. The structure of the eye, the external is normal and I did not notice any abnormalities. And then we're gonna do the ophthalmoscope. You know, we don't have an ophthalmoscope here, but we're just gonna pretend that we have one. I could see the optic disc and the retina was intact there. Normal. And the ears, I could palpate the ears. No tenderness, no pain.
No.
Can you close your eyes?
Mm-hmm.
Can you tell me what you hear?
Dark. Dark.
Whisper test is intact for cranial number 8. And then we're gonna do a Rhine and a Weber test. This is a Weber test, so this is a tuning fork. I'm just gonna pretend this is a tuning fork. Just gonna put it here. Can you tell me when you vibrate? Can you hear it equal?
Yes.
This is a Rhine. Can you tell me it vibrate?
Yes.
Can you hear it now?
Yes.
Okay. So the cranial number 8 is intact. Now I'm gonna check the tympanic membrane of the patient. So when you do an adult examination for the ears, you have to pull it higher up. When the kids is down for the pinna. So the tympanic membrane is clear, pearly shiny, gray, and intact. And then, yeah, we do the cranial nerve 1 and until 10 already, and the accessory, so we're done with that one. So to note for the geriatric, they might have problem with their eyes, with the cataract or the macular degeneration. And for the ears, they might have hearing loss and presbycusis is what they called it, right? And then maybe they're gonna have tumor, or some older adult had loss of smell and a glaucoma for the eyes also, right? And then I'm gonna check the thyroid gland. It's not swelling. And you're gonna do just one hand at a time for the jugular vein. And then just can you swallow for me? I did not notice any deviation for the trachea here. The neck and palpitation of the lymph node is there. I did not notice any lump or abnormalities. And then patient was able to move his head when I came here earlier. And the muscle strength is intact too as his crutch. The thyroid, cranial 11 was there. Now we're gonna move on to the anterior, lateral thorax, the anterior. So we're gonna do inspection first. Then we're gonna check for the fremitus, tactile fremitus for the patient, right? Then just can you tell me 99?
99. 99.
Okay, now we're gonna percuss. So after percussion, we're gonna do an auscultation. So for the anterior part, we're gonna do a 5 field, right? Can you take a look first? Patient was able to, I didn't hear any abnormalities from the lung auscultation, and no using of auxiliary muscle. It seems like the patient is breathing normal and the rhythm is normal. And then for the geriatric consideration for the lung field is COPD and barrel chest. You know, mostly older patient is prone to COPD, emphysema, and barrel chest. And then I'm gonna check the heart sound while we're doing the anterior part. So usually we do inspection, any pulsation or apical pulsation here, you can feel it like that. And then we can do percussion, palpitation. And now I'm going to do auscultation for the heart. This is where the S2 you can hear. And then the S1 is here. And the apical pulse. I did not hear any abnormalities for the patient. Rhythm is normal. And then while I remember this one, I'm gonna do a vital sign. It's okay.
You can really do it anyways.
So we're gonna do a vital sign. How are you feeling, Miss Jessica? Are you still feeling okay?
Yes, thank you.
So blood pressure is 120/90. That is normal range. And I have a pulse oximeter here that we can do your oxygen and pulse, and I'm gonna check your temperature. While doing this, you're gonna check for respiration. As far I noticed with the patient, she had 16 respiration per minute. The oxygen is 98% and the pulse is 77. The temperature is 97.6, which is normal. Patient is a febrile. And now will I remember that one? I'm gonna check. Can you close your eyes and open your mouth for me, and can you tell me what it is?
It tastes like salt.
So sorry if I give you a lot of doses with that one.
It's okay.
I got that one. Then I'm gonna move to the back. Can you face towards their chest like that? Thank you. And then we're gonna do an inspection. First, I'm gonna do inspection of the back and the cortibio-vestibular. Oh my goodness, I could not even pronounce that one. Costivertebral angle. So while doing inspection, you can you say 99, Jess?
99.
For tactile primitus.
99.
Can we percuss? Okay. And I'm gonna do auscultation right now. Can you take a deep breath for me? And then we're gonna check for paraspinal muscle. I did not see any abnormalities, and its patient looks nice, and the skin looks good. And then the sounds is normal. There's no palpitation and muscle lumps. If anything that you could see or palpate, can you forward, face forward here, Jess? And then we're gonna check for the skin of the abdomen. So for the abdomen, there is a special that you don't palpate, you do the palpitation last, right? So you do the inspection, and then we're gonna do auscultation. And then we're gonna listen for the aortic palpitation. I did not hear any aortic palpitation, so we're gonna palpate for the spleens. The spleen is in the left side, right here. And then we can do a light to deep palpitation for the abdomen. And while you do that one, you palpate the spleen also in the left side. And we're gonna go this way, that one. And then we're gonna palpate the liver. It's in the right side. Okay. So you're gonna try to do for pulsation for the aortic pulsation, if you can feel it, if you can notice anything. And then can you look at your skin, Jess?
Absolutely.
Yeah. Patient's skin was warm and intact and appropriate for the ethnicity. Then I'm gonna do a capillary refill. Nails is clean and intact and it looks pink and moist. Capillary refill less than 2 seconds. And then I'm gonna try to check the brachial pulse. And this one is the brachial and this one is the radial pulse. I can feel it. Can you close your eyes, Jess? I'm just gonna check for sensation. Can you tell me if it's cold or hot? Okay.
Cold. Cold.
Sensation is intact. Can you feel any gut pain?
Yes.
Okay. And then we're gonna check for reflexes. So this is the the bicep. So we're gonna do like this, and this one here is the brachioradial, and then you can do like that too, right here, something here.
That's the tricep.
Tricep. Yeah, and you
It's
can
like right in here.
you can do it in the other side, the same thing. So the reflex of the patient in the upper extremity is intact. Chest, can you? I'm gonna check your here. I'm gonna check your popliteal, and then this one is the Achilles pulse here, right? And this one is the plantar.
No.
Yeah.
Dorsalis.
Dorsalis pedis, I mean. So the skin looks nice. The patient had a tattoo. I think sometimes you need to document it. What's you know, what you what you inspect and what you see, right? And then, can you touch your chin, your heel, your chest? Okay, the other side too. Okay, I'm gonna check your inguinal pulses. Here, I'm just gonna pretend here. Yeah, inguinal pulses was there. Femoral, motor, you know, can you stand up for me? I'm just gonna move this one a little bit. Can you walk forward, Jess? Okay, backward. Can you walk with your toes? Okay, backwards. Can you walk with your heel? Okay, we're gonna perform. I'm gonna check your spine. Can you touch your feet? While you do that one, you can check the spine. Spine is okay, line up. And then I'm gonna do a lumbar test. Can you close your eyes? Move like that. Can you put your feet together? So when you do the lumbar test, you make sure that you're supporting the patient because some old people, they have a shuffling gait and they could not stand well. So you have to protect them. And then we're gonna, can you put your hands like this, Jess? We're gonna do a pronator drift. The patient is not drifting and the patient's lumbar test is normal. She could walk to her heel and toes without difficulty. And then we have a consideration for the geriatric. The geriatric might have a osteoarthritis or bone degeneration. And you have to consideration when you do the assessment also for pain for people who have pain, right? That we're not gonna overdo, right? And then I think we do everything. Okay. Jess, can you touch your nose? Close your, yeah. Then can you touch this one faster? Okay, patient was able to do a fast movement coordination. And then I did not notice any edema on the feet. That's what the consideration for the older people also is the edema. And then we call this when older people had a problem with a heart problem and a kidney. They might have an edema in the legs, swelling edema. Is that right?
Yeah.
Yeah. Okay.